Governor Pritzker late today saying the sweeping cuts confirmed by the White House to thousands of programs.
Last night, President Trump plunged the country into chaos.
On a night with no prior warning, President Donald Trump announced a sweeping decision to halt nearly all federal funding across the United States. This unprecedented move affected billions, possibly trillions of dollars that directly supported states, cities, schools, hospitals, and small businesses. The freeze triggered immediate chaos, with critics describing it as a dagger at the heart of the American family. Both red and blue states, urban and rural areas alike, were poised to face dire consequences, particularly in essential services such as disaster assistance, food aid, and health care for vulnerable populations. The stated intention behind this decision was rooted in a fiscal strategy aimed at reducing spending and reallocating resources. The Trump administration emphasized its desire to pause funding for initiatives perceived as unnecessary, such as diversity programs and environmental policies. While some individual assistance programs like Social Security and Medicare were explicitly excluded, the shockwaves of this sudden announcement left many Americans concerned about their future. This abrupt halt to federal funds marked a critical turning point in the administration's governance approach, setting the stage for fierce political battles and legal scrutiny over the constitutionality of such a measure. Political reactions and criticisms. The federal funding freeze sparked immediate outrage from political leaders, particularly from Democrats, who condemned the decision as dangerous, illegal, and unconstitutional. Describing the move as lawless and cruel, critics likened it to a political heist targeting essential services that millions of Americans rely on daily. Some lawmakers highlighted the severe impact on communities across the nation, including cuts to disaster relief, rural hospitals, aid for the elderly, and food security programs. The freeze was perceived as a deliberate attempt to dismantle public investments that benefit vulnerable populations while reallocating resources to fund tax cuts for the wealthy. Political figures framed the decision as part of a larger agenda, linking it to Project 2025, a controversial conservative initiative aimed at shrinking government involvement in social services. They accused the Trump administration of disguising the freeze as a fiscal responsibility measure while undermining public trust and safety. In the Senate, demands were made to halt key Trump administration appointments, such as Russ Vaught's nomination, until the funding freeze was reversed. Lawmakers also pledged to challenge the decision in court, arguing that the president lacked the constitutional authority to suspend funding without congressional approval. The backlash underscored a growing rift between political factions, with many predicting lasting consequences for the administration's political standing and potential legal battles over executive power. Impact on key federal programs. The federal funding freeze announced by President Trump had widespread implications for essential programs across the nation. While the administration insisted that individual assistance programs like Social Security, Medicare, and food stamps would remain unaffected, other critical sectors faced immediate threats. Programs exempted from the freeze, Social Security benefits, Medicare and Medicaid, food stamps, and welfare benefits. The administration emphasized that these programs would continue without interruption, aiming to alleviate concerns among recipients of direct federal assistance. Programs affected by the freeze, disaster assistance. Vital funds for emergency relief and recovery were put at risk, raising concerns about the nation's ability to respond to natural disasters. Local law enforcement. Financial support for police and security initiatives was suspended, affecting crime prevention efforts. Rural hospitals and healthcare. Smaller hospitals, already under financial strain, faced additional challenges without federal aid. Educational institutions. Funding for schools and student programs, including lunch programs, was paused, jeopardizing access to essential services for students. Scientific research. Key projects, including cancer research, faced disruption due to funding uncertainties. Policy justifications. The administration framed these cuts as necessary to eliminate funding for programs it deemed wasteful, such as diversity initiatives, environmental policies, and what it described as social engineering efforts, The freeze not only disrupted financial flows to essential services, but also prompted widespread fear and confusion about the government's long-term fiscal strategy. Critics warned that prolonged pauses would cripple community programs, weaken healthcare systems, and stifle scientific progress. The federal funding freeze announced by President Trump had serious effects on many important programs. While Social Security, Medicare, and food stamps were protected, other areas like disaster relief, education, and healthcare faced major risks. Funding for rural hospitals, school lunch programs, local law enforcement, and research projects was paused, creating uncertainty and concern across the country. Critics argued that these cuts would harm vulnerable communities, weaken public services, and disrupt critical projects, while the administration claimed it was a responsible step to stop spending on unnecessary programs. The funding freeze raised serious legal and constitutional concerns, particularly about the separation of powers between Congress and the president. Under the Constitution, Congress holds the power to allocate federal spending, not the executive branch. By halting funds already approved by Congress, critics argued that President Trump was overstepping his authority. Legal experts warned that this action could undermine the fundamental system of checks and balances. They also pointed out that the 1974 Impoundment Control Act prohibits a president from withholding funds without following specific legal procedures, which the administration was accused of ignoring. Many predicted that courts, including the Supreme Court, would likely strike down the freeze as unconstitutional. The Trump administration defended the federal funding freeze as a responsible measure to protect taxpayer dollars and ensure efficient government spending. Officials emphasized that the freeze did not affect individual assistance programs like Social Security, Medicare, or food stamps. Instead, it targeted what the administration called wasteful spending on programs related to diversity initiatives, environmental policies, and social engineering efforts. They described the move as a temporary pause, while the Office of Management and Budget reviewed federal expenditures to align them with the administration's policy priorities. President Trump framed the decision as part of his promise to be a good steward of public funds. Experts viewed the federal funding freeze as a dangerous overreach of executive power with significant legal, political, and societal consequences. Legal analysts highlighted that the president's authority does not extend to unilaterally withholding funds appropriated by Congress, warning that this move directly challenged the constitutional principle of separation of powers. They predicted strong opposition in the courts, given Congress's exclusive power of the purse. Beyond legal concerns, experts cautioned that the freeze could disrupt vital public services, from healthcare and education to disaster relief and research funding. They emphasized the pervasive role of federal financial assistance in everyday American life, warning that prolonged uncertainty would create instability for states, local governments, and countless institutions. Many predicted that either the administration would be forced to significantly scale back the freeze or face defeat in court, as past similar actions had been met with legal setbacks.